morning, Tuesday, August 11, 2026. We are streaming live spine surgery from Deuk Spine Institute. And Kimmy is actually our technician today doing the stream. She was trained by Anthony, who's with her. And the two of them are going to be doing the live stream for this patient. Our patient travels here from New York. All right. She moved just a little bit, which shot. I'm trying to get into L5-S1. Jordan, show the audience where L5-S1 is. That's right. That's the L5-S1 disc right there. Shot. We're going to enter the disc through a natural opening that's already there. Shot. That natural opening is called the neuroforamen. The neuroforamen is basically a hole in the side of your spine where nerves come out. So we're going to be passing next to the nerve, and while we're doing the surgery, we're going to have to protect the nerve so it doesn't get injured. We're going to be repairing 3 discs that are herniated, L3-4, L4-5, L5-S1. And 2 of them are being repaired from the left side. We're in. 1 of them is being repaired from the right side. Why would we do that? By the way, if you have questions, feel free to ask us. The way you ask questions is you type in your dialog box on YouTube, LinkedIn, or Facebook. You just type in a question. And Kimmy will read the question to me out loud. I'll repeat it usually so everybody can hear it. I'll do my best to answer your questions. Now, during the surgery, we're also going to show you some videos of things. And the first video we're going to show you right now is the 30 different causes of back pain. And there are 30 causes of chronic back pain. AP? 30 causes of chronic back pain. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk Laser Disc Repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk Plasma Rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see from the video there are 30 very specific causes of back pain. Deuk Spine Institute has identified the 30 causes. We're the first in the world to do it. And we also have treatments available for the 30 causes of back pain. The only ones we don't really treat are bad infections of the spine or tumors of the spine. We send those patients out to the university hospital. But everything else, 99.5% of lower back pain can be cured here at Deuk Spine Institute, chronic lower back pain. Okay, in this patient, she's from New York. She had 26 years of back pain, 26 years of her life. She suffered with debilitating back pain. She found us online on YouTube and our website. We did a virtual consultation, diagnosed her with back pain coming from the L3-4 disc herniation, L4-5 disc herniation, L5-S1 disc herniation, both piriformis muscles, and the right sacroiliac joint. Now, we're not going to be treating the SI joint or piriformis at this moment. We're focused on repairing 3 disc herniations. Lay still.
Okay, don't move. Can you open your eyes for me? Are you having any back pain?
All right, we're going to wake her up just briefly, and then we're going to put her back to sleep. She was sleeping comfortably, but we want to test the 3 discs to see if they're causing pain. We call this an evocative discogram. It's the only test in the world that will confirm if a patient's back pain is coming from the disc. Dr. Berndes, are we ready?
Yes.
Are you comfortable? Lay still. Lay still.
Don't move. You're doing great. She's talking. Okay, don't move.
All right, lay still. You're doing great. Now, I want to say one more thing. She came to our clinic in a wheelchair. That's how bad her pain is. She came with her best friend from New York, and he's here taking care of her, looking after her. But she was in a wheelchair because her back pain gets so bad. Are you having any pain?
Are you having any pain right now?
Lay still. How bad is that on a scale of 1 to 10? How bad is it?
10?
Is that where you get back pain?
Yes.
Great. We found one painful disc. Congratulations. We're going to fix that. Is it better now? All right. I just tested the L5-S1 disc. You can see on the x-ray. Jordan, show us the tear. Kimmy, can you see the x-ray there? See the dye within the L5-S1 disc? It's leaking out. Now it's the tear in the back of the disc we have to fix in order to get rid of the pain. Are you comfortable? We're going to test the other discs as well. Are you having any pain? No? Lay still. How bad is that pain on a scale of 1 to 10? How high? 10? All right. 10, yeah. Is that where you get back pain? Is that where you get back pain? All right. Congratulations. We found 2 discs that are causing your back pain. We're going to fix both of them. We're going to put you to sleep in 30 seconds, okay? Just bear with me. We're almost done. I'm so sorry we have to do this. Folks, this is valuable information we're gathering. We now know that the L4-5, L5-S1 disc herniations are causing her back pain. How bad is that on a scale of 1 to 10? All right, 10. She said 10. We're done. We're done. You get to go to sleep. Is that where you get your back pain? All right. She said yes. So the C stands for concordant. That means that the pain I created by injecting a few cc's of dye into her disc is the same pain she gets every day. Lay still. Great news. When you wake up, that pain will be gone for the rest of your life. Congratulations. Yeah, that's just medicine going in your arm. Relax, you're doing great. All right. So, any questions from our audience, Kimmy?
Yes. This is from Darren off YouTube.
Shot. Yes, Darren.
How does DLDR address degenerative disc disease?
That's a great question. So, Darren on Facebook?
YouTube.
Or YouTube, sorry. So, degenerative disc disease is normally asymptomatic. What that means is degenerative disc disease causes no problem for the patient, which is why there are tens of millions of people that have degenerative disc disease and they have no back pain, no leg pain, no symptoms at all. They don't even know they have it. As a matter of fact, they may go get an MRI of their abdomen and they see degenerative disc disease on their MRI scan, but they have no symptoms at all. That is typical. Most people, 9 out of 10 people with degenerative disc disease have no symptoms. So why does 10% have symptoms of back pain or leg pain? The answer is the annular tear is the reason these people have symptoms. It's not the degenerative disc disease, as you may think. Degenerative disc disease itself causes no symptoms at all. Yeah. So what we do with our laser is we go in and fix the part of the disc that's degenerated, that's causing back pain and leg symptoms. Okay? A disc problem, like a degenerated disc or herniated disc, can only do 2 things. It can cause back pain or it can cause leg symptoms. The third thing is it could be silent, which is most degenerated or herniated discs are silent. They cause no symptoms. People have normal lives. We don't treat those at this time. However, people with back pain and leg weakness, numbness, tingling, or pain, like sciatic pain, their symptoms are not coming from degenerated discs. They're coming from the annular tear in the back of the disc that's inflamed. And that's what this surgery fixes. That's why this surgery is so precise, is because it only fixes what needs to be fixed. All the other surgeries out there are treating things that don't need to be treated. Great question. I hope you understand the answer. Keep the questions coming. Now, let's show the audience, Kimmy, how a degenerated disc or herniated disc, same thing, how they cause so much back pain or leg symptoms. What's the mechanism by which they do that?
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. And so, Darren, If you watch that video, you can see that some traumatic injury caused the annular tear to occur, but at the same time, the injury crushed the little jelly in the center of the disc called the nucleus pulposus. Once the nucleus is crushed, it fragments into pieces, and those pieces start to scar up and dry out. They start also to move and shift their position. They shift their position because of the pressure that people put on their lower discs with standing, walking, bending, twisting, just regular activities throughout the day. You put a lot of pressure on your spine and your lower back, and you put a lot of pressure on those discs. So what happens then is you're pushing pieces of herniation out. Pieces of the fragmented nucleus start working their way out through the tear, because that's the path of least resistance. I'm the first person who actually described this, and we have videos to prove it, which we're showing you. But that's what we're fixing right now with the laser. That laser fiber is the most precise tool in medicine. You could see that glass fiber is 1 millimeter wide, 1 millimeter. There is no tool in medicine that is as precise, accurate as the laser, none. And this laser fiber, even though it's 1 millimeter wide, it actually can be controlled by the surgeon to remove and operate on pieces of tissue that are 1/20th of a millimeter. That's 1/20th, a fraction of a millimeter. That's why we use the laser, because it's so effective at removing the herniation out of the tear, cleaning the tear, removing the granulation tissue and all the inflammatory tissue, the bone spurs, calcium deposits that are found in a herniated disc over time. This patient's had back pain for 26 years. These injuries are 26 years old, these disc injuries. Now let's show the audience, including Darren from YouTube, how we repair these degenerated and herniated discs with the laser.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Here is the first disc we just repaired, L5-S1. You can see the tear that was there. We cleaned out the herniation. Now her body will literally seal this off herself, and the pain will be gone when she wakes up. The pain from this disc herniation that she's had for 26 years is now gone at L5-S1. We still have to do the next disc, which is L4-5, and the other one, L3-4. So if we only do one disc, then the patient's pain will be 1 out of 3 or 1/3 gone. So if we want to get rid of all of the pain, we have to treat all the sources of back pain. In her case, she has 3 discs that are causing back pain. We just confirmed that, plus an SI joint, plus 2 piriformises. So she has 1, 2, 3, 4, 5, 6 out of 30 causes of back pain, 6 out of the 30. It's very important, if you're going to have treatment for your back pain, that your doctor make the right diagnosis. And what I found is that 99% of doctors do not make the right diagnosis. They make the wrong diagnosis. Therefore, you get these shots or treatments that don't work. They don't give you permanent pain relief. If a doctor is successful at diagnosing and treating your back pain, your back pain will go away permanently the rest of your life. And yet, we don't see that happening at all. We see it rarely happening. And the reason it rarely happens is the doctors are, number one, making the wrong diagnosis, and number two, they're providing the wrong treatment. So wrong diagnosis, wrong treatment. At Deuk Spine, we are able to diagnose your cause of back pain 95% accurate with just a Zoom call. 5% of the time, patients show up and they have another cause we didn't catch. So we got to add that treatment to their surgery. We have a case of that actually today, where a patient came here with 3 disc herniations causing back pain. And when I did the exam on Zoom, I did not see any other sources of back pain. But when she showed up in the clinic for the first time and I examined her, she had not only 3 discs, but also the bilateral SI joints causing pain. So now we're adding her SI joints to the treatment. That's basically almost impossible to avoid, because when we do our examination, remember, we're getting a snapshot of where your pain is. One of the biggest mistakes people make is that they think the MRI scan shows the doctor where pain comes from, but it doesn't. The MRI never shows the doctor where pain comes from. Doctors have to figure out where pain comes from by using diagnostic imaging, but also the physical exam and using their knowledge of pain, which most doctors don't know where pain comes from, so they're not able to make the right diagnosis. Any other questions?
No questions.
Did we show the video on how the Deuk Laser Disc Repair gets rid of the herniation and cleans the tear, doing a debridement?
Yes, we did.
All right, so we showed those 2 videos plus the 30 causes of back pain.
Yes.
Let's show the audience why the surgery you're watching right now, this is laser spine surgery performed at Deuk Spine Institute. Let's show them why this surgery is the very best treatment available in the world for back pain from a herniated disc or degenerated disc. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk Laser Disc Repair. We've been performing the Deuk Laser Disc Repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. With Keanu Reeves. We're just talking about movies, folks. Thanks for watching. So the Deuk Laser Disc Repair, it's the surgery we're doing right now. Pioneered at Deuk Spine Institute by myself, the founder. I've been doing this same surgery for 20 years. We've had, how many laser surgeries have we done today? Anthony, what's the tally to date?
2,792.
2,792 of these surgeries.
Yeah, DLDRs, yeah.
And in 20 years, 2,792, almost 3,000, we've never had a surgical complication, not one. It's the safest spine surgery that can be available in the world. I can make that statement because it's true. All other spine surgeries have complications. This one doesn't. Also, we don't have adjacent segment disease. This is a big tear at L4-5. It's a big tear. Look how deep it is. I'm still fishing out pieces of herniation. I'm just about finished at L4-5. If you have questions, feel free to ask me. But this is a big tear from ceiling to floor. Okay, we're almost done. I've got just a tiny bit left right there, and we'll be done at L4-5. We got one more disc, L3-4, left side. I have to switch sides. So if you have questions, type them up. You can see the pink inflammatory tissue right there. Any questions from the audience?
Yes. This is from Mr. Darren on YouTube again.
Hi, Darren. Sure.
He said, last week, my 13-year-old daughter, who had scoliosis with a close to 80 degree of curvature,
Wow.
they fused from T2 to L1. She was in the hospital for 5 days. I've seen your patients leave the same day. How?
Well, first of all, God bless you. I hope your daughter makes a full recovery. I know how stressful it can be when it comes to having your child have such major surgery. I hope it goes well for her and she has a full, beautiful life. 5 days after having a T2 to L1 fusion is pretty amazing. Yes, if your daughter came here, she would have gone home the same day. How do I do it? Good surgical technique. I have the most advanced surgical technique in the world. It's just about being the best. There's no other way to say it. It has to do with how we treat the muscles. It has to do with how careful I am at placing the screws and rods and correcting the deformity. It has to do with a lot of things. How we manage blood loss, for example. How we manage pain, post-operative pain. Those are all very important things when you're doing spine surgery where you're fusing multiple segments. So managing blood loss properly, managing pain properly, managing trauma to the tissues. That's very important. Not doing damage to the muscles, not doing damage to the ligaments, avoiding all those damages. Those are very important in terms of having a quick recovery. Part of it's also how you manage the patient's post-operative pain, you know? So we manage the pain with the most advanced pain management techniques in the world. And that gives patients great pain relief after the surgery. So minimize trauma, minimize bleeding, minimize operative time, minimize post-operative pain. Those are really the main caveats of having successful invasive spine surgery that is outpatient and the patient's happy and doing well. Early mobilization is another. Getting the patients up, walking basically the next day, up walking around. That's what we do. We get our patients up the same day walking around, but really 20 minutes twice a day, starting the next day. So it's just a lot of things that Deuk Spine does better than anywhere else in the world, including fusions. We don't really advocate fusion, but your daughter sounds like she needed it. So I agree with that kind of curvature. It's better to get that done early, and that way she can enjoy life to its fullest. So like I said, I hope she makes a beautiful full recovery. And I hope that you are blessed with her making a great recovery. Okay. That is looking pretty darn good. I may want to zap just a few more zaps and we're done at L4-5. We're going to move on to L3-4. I'll switch sides. Any other questions from our audience?
Yes, this one's from JD on YouTube.
Hi.
He says, will the patient be able to walk after the surgery without pain and eventually even ride a bike?
Yeah, this patient is going to walk today without the pain that she's had for 26 years in her lower back. She's going to have some soreness from my procedure, which will last a few hours, but our patients don't get narcotic painkillers after surgery because they don't need them. So no narcotics, no opioids, just Tylenol and muscle relaxer called Robaxin. All right, we're done here. There you go. One more disc to go, folks. Then we're going to end the stream and bring you back for her SI joint. The right SI joint is very painful. We're going to go in and do our Deuk Plasma Rhizotomy. The entire 2 discs were repaired with that 7mm cut. It's a 1/4 inch. And by the way, she's doing amazing right now. She's sleeping comfortably. I'm going to switch sides and come over there to do the right L3-4. So some people may say, Dr. Deuk, why don't you just do everything from the left side? And the answer is this. Most people with back pain, they also have leg symptoms. So they may have weakness in the leg, numbness in their leg, tingling from a pinched nerve, or they could have pain. So to fix the leg symptoms, I need to go on the side of the leg that's bothering them. In her case, both legs were problematic, so I had to go on both sides. It turned out that the L3-4 disc was worse on the right side. The L4-5-1 discs were worse on the left side. So that's why I chose this surgical plan. So it's not just a matter of fixing back pain, but it's also a matter of fixing leg symptoms too. Any questions about that?
No questions.
All right, we're just about to go through the tear right now. I'm hammering the dilator tip to go through the posterior annular tear at L3-4, and then we're going to fix this disc. Remember, before I started fixing the discs in her, we tested those 3 discs with a discogram called an evocative discogram. And indeed, those 3 discs were causing her back pain. All right. She said it was a 10 out of 10 pain when I did a little injection of some dye. If her discs were not causing pain, she would not feel any pain at all. So I use the discogram as a confirmation that we're treating the right source of back pain. And we've never had a disc where we're operating on it, tested it in the operating room with a discogram, and it was not painful. We've not had 10 out of 10 pain every time, but we've had a few 8s and 9s and maybe an occasional 7. But they've all been painful. Here. Any questions?
Yes, this one's from Bobby on YouTube.
Hi, Bobby.
What is the cost per disc? Will PPO insurance cover any costs?
Great question, Bobby. So the cost per disc depends on if we're doing lumbar, thoracic, or cervical, because the surgical needs, the anesthesia needs are all different with each one. And the cost per disc depends on if we're doing one side or both sides of that disc. Will PPO insurance cover it? Typically it will, but we are not contracted with any PPO insurance at the surgery center. So the surgery center is out of network, but PPO insurance is supposed to pay for out of network services. So we will bill the insurance and hopefully they will pay. If they do not pay, then you, the patient, and us have to work together to appeal their denial, send in documentation, which we do for you, and then in the end, we may have to pursue the insurance company legally to get them to pay. So just like any other hospital or clinic where the insurance doesn't pay, which they do all the time, not pay, because let's face it, if they don't pay the bill, they get to keep that money as profit at the end of the year. Every dollar they deny, they keep as profit at the end of the year. Now, the shareholders may not ever see that profit. It may be diverted out of the company, the insurance company, into a subsidiary And then the really super rich special guys and gals get that money that you never see. In the end, though, every denial from an insurance company results in more profit for them, period. And that's the problem with healthcare today. The insurance companies deny surgery and treatment for patients just to be more profitable. Not because it's best for you, but it's because it's best for the people that make the profit. So that's the problem in America and other countries as well, is insurance companies are rewarded for denying you your treatments. And it's getting worse. The Wall Street Journal published an article February 12th, 2024, that they showed that the health insurance companies in America denied 850 million treatments. 850 million treatments. Okay, so all of those treatments didn't happen here at Deuk Spine, that I assure you. But we have had a couple of hundred, but the other 850 million happened all over the country. These are denials, folks. This is your insurance denying payment. And the problem is the insurance companies have written the laws to protect themselves when they deny. And they wrote those laws back in the 60s and 70s. So they saw the future, that the only way that their profits would be threatened is if doctors and hospitals would start doing more treatments, which we do, right? As technology improves, we offer more treatments to patients who are suffering. So they saw that increased technology and increased treatments as a threat to their profits back in the 60s. So they wrote laws like the ERISA law that allows them to deny treatment and not pay for it and not be held accountable. That's what we're dealing with today with a lot of insurance companies. We have to sue them to get them to pay. And they would rather force you to sue them because there's no punitive damages. They wrote the law that protects the insurance companies. The insurance companies wrote the laws, federal laws, that protect them from punitive damages. That means damages that the plaintiff can bring for not paying the bill that punishes them for wrongdoing, like just for misbehaving, being really bad. So no punitive damages, no treble damages, no lawyer's fees. So basically they set the stage for providers, hospitals, doctors to be screwed out of their payments and to not have any cause of action to go after the insurance company. They've made all these little rules. So they are not your friends, these health insurance companies. They're absolute pure evil. And when I was a kid, my father was a doctor. Insurance companies paid the patients directly. So a patient had a procedure done, they pay the doctor or hospital, and then they would get a check from the insurance company and they would get reimbursed for the expense. So the insurance companies, by not paying back in the 80s, they would screw the patient. Now, how many patients do you think you can screw as an insurance company not paying their bill and get away with it? Not many. So what happens was the insurance companies realized it was bad publicity to not pay the bill back to the patient. So they changed the laws and rules, and now they said, okay, the patients aren't going to pay and we're going to pay them back. We're going to make the doctors pay for their treatment of the patient, and we'll pay the doctor back when they bill us. Well, that was all good and fine in the beginning, but then they stopped paying the doctors and they stopped paying the hospitals. So what you've seen over the last 40 years is doctors going out of business, hospitals going out of business all over the country. But you'll never see it in the news because the news is controlled by the insurance companies as well. They basically don't want Fox News or MSNBC talking about hospitals closing, but it's happening all over the country. Hospitals are closing. Hospitals are reducing the services they offer, right? So what happens is if you have an emergency, for example, the hospital I used to work at here in Brevard County, the payments for neurosurgeons went down so bad, literally 50% decrease. over 20 years that no neurosurgeons want to work at that hospital anymore because they just get screwed out of their payments by the insurance company. So now there's no neurosurgeons at that hospital. And when a patient comes in with a trauma to their head and they're dying and they need a neurosurgeon to do brain surgery to save their life, there's no neurosurgeon available. So the hospital has to transfer the patient to another hospital somewhere that has a neurosurgeon available. And guess what? Those hospitals are full. Their beds are full. So they can't take the transfer. So your family member just dies in the emergency room from a herniated brain, from a hemorrhage that's totally fixable, except that the insurance companies have destroyed healthcare in our country and put doctors and hospitals out of business. So that's where we are today. So when you ask, does my PPO insurance cover this surgery? We hope it does. It should, but it's a battle sometimes to get the insurance companies to pay. And you folks, you patients, don't hold them accountable. So how do you hold an insurance company accountable? You have to fight them in the court with a lawyer. We'll help you do it. That's the only way you can bring about meaningful change with insurance companies. They're bullies. They're not there to be your friend. They're destroying medicine in America. That's why America's ranked 64th in the world, at least last time I checked, months ago. We used to be number one back in the 80s because we had the best medical care, the best doctors. Patients were healthy and happy. They got the treatment they needed. But in the last 40 years, the insurance companies have destroyed our healthcare system by keeping all the money for themselves. And we've let them get away with it. Any other questions, comments?
Yes, this one's from JD off YouTube.
Hi.
With the SI joint repair, is it permanent?
Is it what?
Permanent.
Yes. Great question, JD. Deuk Spine offers, and we've patented and developed and patented the first permanent rhizotomy in the world, and it's only available here. We do knee pain, hip joint pain, shoulder pain, ankles, fingers, thumbs, hands, SI joint, facet joints, any joint in your body that hurts from arthritis. We can perform our patented treatment called the Deuk Plasma Rhizotomy, and it's a permanent elimination of that joint pain. It's safe. We've never had a complication with the procedure. We're about to do it on the SI joint. So bear with us. I'm about 1 minute from finishing this disc, and then we're going to switch over. We're going to end the stream and restream the SI joint DPR. But it is permanent. That's all right. I'm not worried. Any other questions?
Yes, this one's from Darren on YouTube.
Hi, Darren.
He says, thank you. I also have scoliosis and was considering using my daughter's surgeon, but I don't have time to recover in the hospital. I also don't want to lose height. Thoughts?
Yeah, Darren, my best advice to you is we offer a very free MRI review. You do it virtually with Zoom. You don't have to come here. I need to see your MRI, and I need to examine you. Chances are you don't need scoliosis surgery. All right? Maybe your daughter did, but I don't think you do. I need to see you. Do a quick Zoom call. We do this for free. We do it over Zoom. It's literally 10-minute face-to-face with me, where I review your MRI, and I give you my recommendation. All right. We're done. We're going to be back shortly with our SI joint DPR. Let's go ahead and end the stream.